Well, I'm Ray Jackson, and I am the Director of Community Engagement. I've been at Cancer Care for 5 years this year, and I joined Cancer Care looking for a nonprofit to work for with a mission that was, something that needed to be spread throughout the community. And we know that cancer impacts so many people, and so being able to really advocate for individuals and learning about what Cancer Care does was really important for me. And I know that many of our staff have a lot of personal connections to cancer, which also gives everybody a passionate why behind why they're coming to work every day.
My name is Megan Hedges. I'm a counselor and art therapist here. I've been on the team for about a year, and I've really enjoyed being here and providing services for families and kids, giving them an opportunity to do something besides focus on their cancer. This is a place for our clients to connect and to grow and be healthy.
And I'm Carlene King. I am a 15-year breast cancer survivor, and my reason for being at Cancer Care Services started with my cancer journey. Someone had one of the social workers to tell me that I could come here and get a free massage prior to every treatment. So that was intriguing to me. But because of my my business history, I was self-employed and I didn't have any financial struggles. I never would have thought to reach out to a social service agency because most of the time they're only for people who are just kind of barely making it. But once I came, I found out that Cancer Care really doesn't look at, how much money you have. They look at the need and they really try to help you from there. So from there, it's just been, a long, journey, connection, and this has become my passion. And the last 3 years, I guess, is when I joined the organization as an employee. So, for the last about 12, 14 years, I've done this exact same thing out in the community.
The mission of Cancer Care Services is to support all individuals impacted by cancer. So supporting cancer patients, caring for caregivers, and empowering survivors to reduce the impact of cancer right here within Tarrant County. And in 1946 is when our organization began, and it was a group of doctors who came together and said, hey, there are some patients who really need help paying for this cancer. They can't get to their treatment, or they're not going to be able to get any treatment because they can't afford that. So how do we help them and make that change for the better for the community? Since then, in 76 years, the organization has grown immensely, and we've added lots of staff. That staff includes adding counseling programs, like what Megan does for children and adults who are being impacted by cancer and processing that trauma, as well as a lot of the outreach events and the reaching community and where people are, which is what Carlene does. And so really trying to focus on how this is a community effort and how we are assisting everybody in each particular aspect of what their cancer journey is. So it's not only the financial help, it's how do we help the people living in your home? How do we help you with mental health side around this? How are we helping you get groceries? Because that may not be an immediate thought of, that cancer is affecting your grocery bill, but it trickles down. Those barriers of, I have to pay for this treatment, well, now I can't pay for groceries. So in the end, it does all come down to this all-encompassing wraparound services that just has grown from this idea 76 years ago of just helping a cancer patient.
So what Cancer Care Services is doing is we are actually going out into the community to educate the community about the services and the resources that are available. Right now, we have got 10 events scheduled all over Tarrant County, and we're looking for more host sites. But at these events, we're going to be providing well woman exams, mammograms, prostate screenings, everything diabetic screenings, heart health, genetic testing. So just a full array of screenings, medical checks that we're doing, and then we'll also have vendors there that will have all of the resources that are available. Well, maybe not all of the resources, but we will have the resources that are available to the community. So we need everybody to come out. We're taking these into the community right in their backyard and not counting on them to come to the hospitals or to a doctor's office, because we know that these are people that normally wouldn't be going to a doctor's office anyway. And with COVID didn't help us a bit. So now we're seeing an influx of referrals for people with cancer, and unfortunately, they're late stage referrals. So we're trying to get on the preventive side, not just wait until someone is diagnosed, but we're trying to get ahead of it. And at least we can get early stage diagnosis, or at least keep on top of it so that everyone's aware.
The counseling department, we provide monthly connection events through our Connect program. So a Connect event is an event that we organize to provide opportunities for cancer patients and their families to connect to other people going through what they've experienced, and to have a place outside of the hospital, to have a place that is more like home, to be around their support system, to be around other kids. You know, we have a lot of events for kids specifically and families, and a lot of kids really enjoy being with others that know exactly what they're going through. There's not that same stigma of, you look different, you're experiencing cancer. They don't have to explain that to other kids because they just know at these events what's happening.
The number one misconception, which this is for a lot of nonprofits, is awareness. 76 years of being an organization, and there's a lot of people that come by and drive by our physical building and say, "Oh, I drive by every day, and I've never known what it is that you do." So I think part of that goes into the misconception that cancer care is for individuals who need financial help only, who are that lower income bracket. And that's not the case. That is a portion of the services that we provide, which really, you may start here, and then after that cancer, it doesn't take very long for you to get to that bracket where you may qualify for those things. But this is about everybody in the whole family. So even if you're not calling for specific to a gas card, or I need help with my nutrition, the phone call of I just don't know what to do, that's for everybody. So anybody can call, no matter the income level, no matter the cancer type, no matter the age level, and be able to say, hey, this is what I'm going through and I just need some direction.
I think one of the biggest misconceptions that I've seen is that cancer patients don't want to talk about what they're going through. And so many people, because we live in a grief illiterate society, so many people just get really uncomfortable about the heaviness of cancer, and they just don't, because of their own discomfort, they don't want to talk to people about what they're going through. And so I think that it's really important for those people to know that we're here. We're not going to be shocked by what they tell us. That our counselors are here to hold that with them. And the people here, too. A lot of our employees have experienced cancer directly, so they're not going to be shocked either. They might know firsthand what it's like to go through exactly what they are going through, too.
I think one of the biggest misconceptions that we see out in the community, which I had myself, is that it's, like Ray said, it's only for low income. And then even if they haven't really thought about that, it's, well, what's the cost? Because I don't have a lot of money. If I'm having to pay for medication and pay for all this other stuff, I don't have money to pay you all to help me do this. So what I say a lot of times is, of course, there's no cost to our clients, which is, we know it's a big difference than being free because somebody's paying for it. But there's no cost to our clients for any of our services. And that's something that, I think kind of hinders people from reaching out to us for any assistance. Suggestions that I would have, first of all, and this is really, really where I'm really passionate about this, is people speaking up and being advocates for themselves. and not just, taking what somebody else said. Someone could tell them, oh, this is how it's going to be because that's the way it was for them. But you could be, feeling completely different. So you need to be that person that says, hey, I'm going to take responsibility for my own health, and I am going to reach out and ask for help. So that would be my big top two.
I would say that my top recommendation would be to not isolate. It can be really overwhelming to receive that diagnosis of cancer, and it can be hard to get through the day when you have that kind of heavy news. There's so many appointments that you have to do, so many resources you have to reach, so many extra things on top of daily living. But just know that there are people here to walk with you in that. And, our counselors and our other staff members are here to provide resources, to provide a listening ear, to help you with even coping skills to manage the stress of, okay, this is so heavy, I feel like I'm being crushed, and we can help you.
Well, and a recommendation for all of those who are not currently going through cancer diagnosis, we talk a lot about it's not if, it's when. And, being aware of what Cancer Care is doing and being able to pass that on to somebody else and say, oh, you know what, I don't know exactly what this organization can do for you, but I do know this organization can do something, and it is totally worth the phone call or the email just to be able to have a conversation with someone. And maybe that one conversation is enough ease for somebody, but being able to express to other people that it is okay to ask for help, as Carlene said, because we know that can be difficult, and share the mission of what Cancer Care is doing with others whenever you do hear the words that they have cancer. So as far as getting connected to Cancer Care, you can go to our website at cancercareservices.org. We have a Get Help button on that page as well, which will take an individual directly to our referral form where someone can fill out contact information as well as what they're currently experiencing with their cancer, and that will get them connected to a social worker directly. The phone number is 817-921-0653, and that phone number can be called to reach our front desk to help go through that application or that online form, but it also can be texted, and so someone can text that line and get information and access through the front desk too. As far as social media, we have Facebook and Instagram as well as YouTube, all at Cancer Care Services FW, and those are access as good ways for somebody to maybe share some information or see some quick snippets about what Cancer Care is doing in some of our client programs.
You can also look for us out in the community. We will be doing these events throughout Tarrant County. You can find the locations and the times on our social media pages as well as our websites.